Hi, I'm Julie Davis. I'm the physical therapist over here at Trophy Club. Today we're going to talk about falls and total joints. It's our hospital policy that anyone that is a fall risk wear a gait belt. So those are located on the PSU station in the supply room up on a top shelf. So anyone that you feel is a fall risk or feels that you need to have a gait belt on them when they're up and moving around, feel free to grab one of those. We're also going to go over today the CPM, the immobilizer, and then we'll go over trapezes also. So these are the CPMs that we have here in the hospital. Most of our patients' physicians require CPM. Some of them do not, so make sure that you check your order sets to see which patients require those CPMs. Today we'll go over how to put the CPM on. There is a joint in the machine here, and that is where you'll want to line the patient's knee up with. So we'll take the patient's knee here, we're going to go ahead and lift that leg, slide the CPM up underneath her thigh. We're going to go ahead and have her lift her bottom just a little bit and relax it back down. What we're looking for is that the joint in the knee here is in alignment with the joint in the machine here, okay? So we're just a little shy from that. We're going to go ahead and have her lift her bottom one more time, good, and bring it back down. So we'll check again, knee in alignment with the joint in the machine. The foot will go up against the foot plate here, and then if it needs to have any little adjustment, there is the knob right here to kind of loosen and adjust the foot plate. So we'll make sure it's up against that foot plate and secure. The foot will be secured here, and then you also have two straps. So we have one strap for the upper thigh and one for the lower thigh. Okay. Also at the base of the machine here, there are some bars that come out, so you're going to want to make sure that you extend these bars out to the foot of the bed. That will allow the machine not to move while the patient moves up and down. Now, occasionally, the patient will either push themselves out of the machine, or as the bed raises and lowers, the machine itself will walk away from the patient. This is just kind of an assistance to prevent that from happening, but it does still happen. So make sure on your hourly rounds that you are checking the placement of the machine, making sure that that knee is in alignment with the joint in the machine and the foot is up against the foot plate here. Next, we're going to talk about immobilizer. So any of our total joints or total hip patients may require an immobilizer because they've received a block. There's a couple of blocks that they can receive up on the floor. We have the femoral block, which blocks your quadricep function. We have a popliteal block, which blocks the dorsiflexion or the inability to move the foot up. We also have an adductor block that doctors do here, which numbs up the knee area here, but it does not lose the function of the quadriceps. And then also a sciatic block that you see on total hip patients that can affect some of the quadricep function. So those patients, you may see a total hip patient that might require an immobilizer. So the physical therapist will do their evaluation and assess for the strength of the quadriceps. If for any reason a patient is unable to hold up their own body weight or their quadricep function is not working properly, then we'll go ahead and require them to wear an immobilizer until that function comes back. If for any reason we do need to wear the immobilizer, a pink sign, must wear immobilizer when out of bed, will be at the head of the bed and also at the foot of the bed at the communication board. Also, it will be written at the nurse's station communication board for any patient that requires an immobilizer. So that way, if you are not the patient nurse taking care of the patient, you'll know that patient is requiring the immobilizer in order to get up. The immobilizer has to be on anytime the patient's getting up, going to the bathroom, or just transferring into a chair. It's for safety reasons. They're unable to get that quadricep function working, and so when they do start to stand on that leg, it will cause them to buckle down. So what we're going to go over today is how to put on that immobilizer. This right here is the immobilizer. You'll want to put this portion right here on the upper thigh and this portion right here on the lower thigh, okay? There is a small curve in this immobilizer here, and that's where you're going to want the back of the knee to go. Go like this, okay? So we'll put it around her leg here. Good. There is an elastic strap that kind of goes over and secures the knee itself. And then we start strapping her up with the straps here. Remember, when you're strapping up the patient, you want them pretty snug. You don't want them to move around too much because then it'll cause that immobilizer not to do its job and prevent that leg from buckling. So remember, we don't want it too loose so that it's moving up and down. You want it pretty snug so that the strap won't move up and down on them. That way they're unable to bend that knee. Try to bend your knee there for me. There, now it's immobilized. Something you'll want to make sure of too is making sure that that bar is right along the back of the leg. If it's shifted to the side, it also won't do its job of preventing that leg from buckling or bending. Do keep in mind too, if your patient did have a popliteal block, if they do get up the same day and they're going to the bathroom or they're wanting to get up and move around, their ankle function will not be there. So they'll be unable to lift that toe up whenever they're walking. Next, what we'll do is go over the gait belt. So anytime you're going to get a patient up that is a fall risk, you want to make sure that you have a gait belt on the patient. That way it'll prevent any kind of falling here up on the floor. They are located on the PSU Nurses Station Supply Room. Some tips you want to keep in mind is you want to make sure when you're putting this on the patient that it goes through the T side first and then through the smooth side. That way you can anchor it around the patient and get a nice good grip. Okay, so now what we'll do is go ahead and put it on the patient here. You'll want to get the patient to the side of the bed here, and then if they have had an abdominal surgery, then you're going to want this gait belt to go in the upper armpit area here. The standard place for a gait belt is to go in the lower area. So for any of your total knees, total hips, any kind of orthopedic lower extremity surgery, you're going to want to put it around the waist. If you are a bariatric patient or you're taking care of a spine patient, that's when you're going to want to go around the upper armpit area, away from that abdominal area in the incisional area. So again, what you're going to want to do is go through the T side here, and you're going to want it snug enough so only your fingers can fit through here. Then slide through that smooth side, good, to anchor. And then what we'll do is go ahead and get her assisted device so that we can get her up and moving around. Now that we have her gait belt around our patient, we're going to go ahead and transfer her to the bedside commode. Okay, so what you're going to want to do is encourage the patient to scoot to the edge of the bed as much as they can. One hand on the gait belt here, and remember you want to have a grip with the fingers up, not down. That way if she does start to go, you have a good grip on her and she's not going to slip out of your hand. Okay, and then you're going to want to cue her to use her hands off the bed to press herself up into a standing position. If she would be a total knee, then we would go ahead and put most of the pressure through her good leg, okay? So whenever you're ready, we'll go ahead and stand up, then reaching your arms towards the walker. Then what we're going to do is kind of do a turn pivot. So the walker will go forward and then go ahead and turn your body. Good. Stepping forward, good. Turning, stepping forward. And then we're going to want to make sure she backs up to the bedside commode so she can feel her legs touching. Backing up till you feel it. Are you there?
Yes.
All right, then you're going to reach back with your hands, kicking maybe that leg forward that's been operated on, lowering yourself down. There we go. And then whenever the patient is on the bathroom, it's our hospital policy that we stay within arm's length of the patient, whether it be at a bedside commode or in the toilet itself. The patient does have the right to refuse. Just remember to be documenting that in the medical record. Whenever the patient says that she's ready to go, then what we'll do is go ahead and have her stand up off the toilet. Again, scooting to the edge of that toilet as much as possible. It'll be easier for her to get up into a standing position. Let's go ahead and scoot forward a little. Good. And then press with your arms on the side of the toilet into a standing position. Then we're going to turn and turn back to the bed. Good. And then go ahead and back up till you feel that bed. When you're feeling that bed, reach back with your arms. Let yourself take a seat.